o te wai whātulau i le paia man mamalu o Amerika Samoa i le nei tai au fou. O paia whale atunu, o mamalu whale malo, ia whapea foi a paia o le tala lei. O te whātulau watu. Runu atu ia whātini o tausala o paia, ta matua matoto o lātou te wina. O le nei tai au, ua mātou o mai foi e ma le mamalu o le komiti, e tuatu se whaupoponga o whamatalanga o le silafia o le tātou atunuu i tūlanga o le tātou whamai o le koviti. Good morning, American Samoa. We are here today for another edition of our press conference to provide you, our people, we will have flights to repatriate our residents who are currently in Apia. At the moment, we believe there is close to 70 residents of American Samoa who are in Apia, and our plan is to bring them home as soon as possible, as early as Wednesday this week. And once we complete that, then we will close all transportation to Apia. Since there is no community spread in Apia, the folks who are in Apia will be required still to register on Talofa Pass, but they will not be required to test before they board. Testing will be done when they arrive in American Samoa. The second good news, depending on your perspective, is the March 10 flight from Hawaii will proceed as planned. Details on how we receive that flight will be forthcoming. But for the moment, the committee and with the recommendations of our medical community have agreed to allow this flight to proceed as planned. And finally, Code Red. Code Red continues to March 8th to at 12:01 a.m. is when it ends. Code Red, as the governor has announced yesterday, will continue through March 8th at 12:01 a.m. O nai whasila silanga, i le mamalu o le tātou atunuu, pe o na tanoa le fionga i le kovana i le pō na pō, o i le aso nafi, o lea ua whaawau le tātou Code Red, e whaumaina i le aso valu o mati i le sfululua i le taiao, sfululua i le vaveao. O lea foi wa iai le whātua whalainga le mamalu o le komiti, o le a whaawau pea le tātou malanga o lo fuafua mai Hawaii i le aso se fulu o mati. Le aso se fulu o mati, ia o le atau nuun malanga lea mai Hawaii. O le a whatalitali foi se finangalo le whainga malo tutotasi Samoa Atalia le talusanga, ia ona sauni foi leo ni malanga e toi whaafoi mai ai a tangata anu o Amerika Samoa o loo iai le motu tutotasi. O le malanga ia o loo fuafua e whaia le nei vai aso, e silia ma le fitu se fulu tangata anu o Amerika Samoa, ia o loo whape nao na whatalitali se avanoa e toi foi mai ai whanua. Ia o le a mato ngā lulu e pea, le afionga le loia sili, ma le whaatonu ia motu sa e fsotai ma le whainga malo i Samoa, ia mo se avanoa e toi momoli mai ai na i o tātou tangata nuu, o lewa foi o nau mau i Apia. Ia o le a whaasolo le tātou polokalame, o le tu atu mua le avanoa i le afionga i le whaatonu, ia motu sa ma le vaenga o le soifua maloloina, ia mo se lātou li poti, ia a wātu langa o le whamai. A mai alea, ia o na saunoa la i o le afionga le loia sili, ia mua whamamalanga atili e winga i tula ono le Code Red. Ia o na tuatu la i o le avanoa i le tātou au whai newspaper, moni a lato sili puu, ia o na whai wato leo le tātou mafutanga i le saunoanga foi le fionga le maupu ia famuina ia o ia foi o CEO o le tatou falemai. We will start our press conference with a presentation from the Department of Health, followed by the Attorney General, who will discuss the Code Red requirements, and then we will open to the media for their questions, and then CEO Famuina will close us our day with a few comments on what's happening in our hospital as well as our island. So right now, turn over to Director Nua.
Good morning, American Samoa. As a reminder, the first level of protection for you at home and also our people surrounding is masking, social distancing, and also make sure your hand wash is done often throughout the day. If there's any problem, you feel any symptoms of the virus, please don't hesitate to call our department, 219 or 633-5871 or 633-5872. This morning, American Samoa will provide a quick skeleton overview of what's been happening last week and yesterday in regards to testing, vaccination, and also how we're handling our positive cases here in American Samoa. So at this time, I will yield my time over to Dr. Ifili, Dr. Losana, and also Dr. Fiona. Over.
Sorry. Good morning, everyone. Fatalo fatule pa ia mal malu al tatu atunu nei tu la. Avel nev noa tu atuaisa li poti la tamai nei tu sai fo I male fa ma I lo tatu whenga I nei. Waitau. I would like to give out a quick situational report about what had happened last week and yesterday with our COVID-19 outbreak here in American Samoa. Next slide. Are you capturing this on the TV? Yesterday, the Department of Health did not stand up any testing sites or vaccination sites. The only testing that happened yesterday was at the LBJ Tropical Medical Hospital, where 103 tests were conducted, and from those 103 tests, 2 more new positive cases were identified. I also want to mention that this is what LBJ has been averaging so far, about 2 cases per day. Next slide. So looking at our cumulative numbers right now, the 2 cases from LBJ that were identified there after going through their medical profile, the physicians there decided that they met the criteria for therapeutic treatment, and treatment was conducted successfully, and the 2 individuals have been given directives to be isolated at home. So with the 2 new cases, we now have 65 cumulative cases here in American Samoa. These are active cases. All are less than 14 days since they developed, and we're tracking all 65. Currently, our EpiNet teams, led by Dr. Losana Natuva, and some of our EpiNet teams, we are calling everyone every morning to check on their status, look at their symptoms, and to see if they are needed to come back in to get the therapeutic treatment. So we also urge anybody out there in the community, if you have any symptoms or believe that you've been exposed to somebody who has tested positive, to please come out to our testing sites, get yourself tested, and if you test positive, we have physicians there that will be assessing you to see if you need to come in to get the therapeutic treatment. This is very important. We have a small window here to work with. So we can't wait out there. If you get the symptoms, don't wait at home. Come in and get tested. We are also going to be standing up our vaccination clinics. One of the ways that you can really protect yourself is to be, one, be fully vaccinated, and then two, if you are fully vaccinated and has been more than 5 months since your last dose of Pfizer or Moderna, come in and get that booster shot. Continuing on, so right now the cumulative number of people who've been treated on island is now 10, with the 2 new treatments from LBJ yesterday. Hospitalizations, new hospitalizations, there were no hospitalizations yesterday. However, we do have 1 cumulative hospitalization that's been announced in the news previously. This individual came in for reasons other than COVID-19. They were tested at LBJ Hospital, tested positive. All protocols were followed by LBJ to ensure the protection of the hospital. Next slide. We're also tracking where individuals that are testing positive are coming from. And right here on this slide, we have a map of where positive cases are. I'll go ahead and call out the villages and the number of cases from those villages. But if you look at the map, it's color-coded and also color spectrum. Those with light color or light tan, that's where there's no cases. And the darker the color to dark brown indicates higher number of cases. So if you all see there, the majority of the cases are in the central part of Ituau. We have Tualauta, and even at the full counties there, that's where the cases are coming from. But there are cases also on the far left or west side of the island, and also over in Whangasa, and I believe the village in the back is the village of Vatia. So if you look at the map, it's indicating that the virus is spreading very, very quickly. And I'm sure by the end of today, the look of the map will most likely change. So number of cases from Whangaalu, there's 1 case from Whangaalu, 3 cases from Whangasa, 1 from Whailolo, 1 from Whaleniu, 6 in Iliili, 11 in Leone, 19 in Nu'uli, that's the most number of cases from that village, 1 from Pangopango, 1 from Puapua, 17 from Tafuna, 2 from Waitoni, and 2 from Vatia. Once again, please, I urge the community, if you are symptomatic and you know you've been exposed to somebody who's traveled recently or somebody who tested positive recently, to please come in and get yourself tested so that we can make our assessment. However, if you are asymptomatic and you have not had any exposure to anyone, you do not need to come in. Please follow our code red status here, because we don't want too many people to be moving around unnecessarily. The virus is inside your body, and if you travel unnecessarily, you might expose yourself to somebody who has the virus, or if you don't know that you have the virus, you might be transmitting it to somebody else. So please, symptomatic people who have been exposed, come in and get tested. And also, if you know you have 50 years and older and you have existing chronic conditions, we are urging you to come in, get your booster, and also come in, get tested if you're symptomatic so we can assess you. Next slide. This is also pinpointing exactly where some of the cases are coming from. We're tracking this very closely. And then these map locations are used to assist the DPS and also our Office of Samoan Affairs with enforcement of our home quarantine and home isolation policies. Next slide. We're also tracking vaccination status for those who are testing positive. Of the 65 cumulative cases here, 53 are fully vaccinated. 1 individual has had only 1 dose, and this is what we're concerned about. There's 10 individuals that we've identified who has the virus currently who have had no doses at all. So for these individuals, we're tracking them closely with our EpiNet teams. And also, if you're listening to this press conference right now. If you're one of those individuals that have not had any shots, if you start to develop symptoms, don't wait for us to call. You can give us a call and we'll have you assessed at that time. Okay, as far as boosters are concerned, this is another concern about with the task force. 65 individuals who tested positive, only 8 of them have had their boosters. Next slide. This is our epi curve, or looking at the number of cases per day. There's a big surge on the 24th, and then we have a slowdown in the number of cases coming in. This does not reflect accurately what's happening out there in the community. Please don't be afraid to come in and get yourself tested. We need to make sure to have this data to understand how the virus is spreading out in the community, and also we really need to identify those individuals who need the therapeutic treatment. This is how we will beat this virus. 1, get yourself vaccinated, get the booster shot, and then 2, if you are positive or if you have been exposed and you are symptomatic, come in, get tested, and we'll give you the therapeutic treatment. Therapeutic treatment and vaccinations is how we'll beat this virus here in the territory. Next slide. This is looking at the number of cases here by age group. If you see here, majority of the cases are among those who are 5 to 40 years old. These are the individuals that I'm sure that are moving a lot in the community and are coming out to get themselves tested. If you look at our population who are 41 years and older, the good thing is, if you see that, majority of them are fully vaccinated. However, there are some individuals, if you look at the color spectrum there, the red color are among those who are not vaccinated. So please, we have our vaccination sites that are going to be opening up later this week, and in the weekend we'll have a drive-through. When they're open up, we'll give you the location and the time. Come out and get vaccinated. And also at our testing sites, come out, get yourself tested so that we can assess you for therapeutic treatment. Next slide. Looking at the cases by sex, what the data is suggesting, maybe a little bit more female compared to males that are testing positive. But I would like to say that difference right now is probably not a real difference. There's only 65. Sample size is pretty small. We need more data to really see if there's a true difference between females and males testing positive. Next slide. Vaccination. Once again, I'm going to say this again. This is what we're urging. Vaccinations save lives. This past Saturday, we had our drive-through vaccination operation. We understand that it was very crowded, and we had some issues in the beginning. We're tightening that operation down, and we'll make sure that things will be flowing smoothly from lessons learned from this past Saturday's vaccination drive. But if you look at the numbers, 1,209 people came out to get their vaccines. And that's one of the reasons why there was a lot of traffic slowdown of the operation. That's the biggest number that we've seen come out to get vaccinated at any of our sites since we started our operation. The good thing also, we're looking at this, over 1,000 people came out to get their boosters. This is how we're going to protect ourselves for those of you who are 50 years and older or have other pre-existing chronic conditions. Very important that you come out and get that booster shot. Next slide. Now, right currently, among the population of American Samoa, population of 49,710, we have currently 42,046 people with at least one dose, and 39,974 who have completed full vaccinations. There's still some people that are past due, 1,340, that's what we're tracking. So please, if you know you've had that first shot, have not had your second shot, and are due for it, you need to come in and get that vaccination. That's how you'll protect yourself from severe disease and possibly death. We want to prevent all of those. Severe disease will have you hospitalized, and one of the things we want to protect right now is our LBJ hospital. We have only one hospital here on island, and if you're not protected, the chances of you getting severe disease increases, and you would have to go to the LBJ hospital. Next slide. Looking at our boosters, right now we're estimating just about 23.7% of the entire population who are eligible for the boosters have had their boosters. We still need to get people to come in and get their boosters. The good thing is we're seeing that those individuals 41 years and older, the percentage of those coming in to get their boosters is rising up pretty quickly. So please, I urge the population again, when our vaccination sites are stood up, come out and get those booster shots. Come out, get fully vaccinated. If you have not had that first shot yet, have been on the fence for some time, this is the time. Come in and get protected, get vaccinated. Next slide. Looking at our entire population, everybody that's eligible for the vaccine and those who are not eligible. The 8.6% there in pink, those are people who are less than 4 years old and unable to get the vaccines. The 6.8% there in red, those are individuals, percentage of individuals who are eligible for the shot but have not come in to get the shot yet. 80.4% is the percentage of the total population that are fully vaccinated right now. That's a good number. However, we want that number to go up to 90% or higher. The more people that we get vaccinated, the more protected our territory is for developing severe disease or death. 84.6% are those with at least one shot. Next slide. This is the picture of our island and looking at the vaccination coverage by village. The good thing is majority of the village are now in the blue color spectrum, or 75% and higher among those who are fully vaccinated. There are still some villages that are below that number in green color, green meaning 60% to 74% coverage. Where we want to be is at that dark blue, or 90% and higher. Like I said again, the more people that are vaccinated, the more protected we are from severe disease or death here in the territory. And once again, come out, get yourself tested so we can assess you for the therapeutic treatment. Next slide. I think that concludes my portion of the update. I yield my time back to Director Nua. Faftai lava.
Faftai tele tatai fili. Thank you, Honorable Carr, for our time. This time we yield our time back.
Tono yellow fiona loi sili mo tatou code red.
Yeah, whaftai mo lewa noa lo whionga le Command Lieutenant. Yeah, whatalo whātui le paia ma le malu o le tatou atunu o tō paia ma malu. Yeah, ele mwhai e leo nei au nao na whapopo pe tō ese. Yeah, ai malei fua mai. Yeah, male alwhai mai whanunga lei nei tae au. Yeah, malo le soifua. Lau lei male soifua maua le malu o le tatou atunu. O loo whau au pēr le tūlanga o le tūlanga mumu o le polo inga le kovana ilana polo inga le tau whalawalawe whafosei. Ia ona o le nei whaamai o le COVID sulma le iwa. Ma o loo tau fia i le tele o ngā luenga le tatou whai ngā malo. Wangana ai ngā luenga ia e tau o ngā luenga mana o mia po essential ASG operations. Le ngāt foi lea ia o tatou pisinisi, ia o pisinisi e tala mai le lima i le waweao, ia e whaangata mai le whae le afiafi. Le mwhai ona sopo atu le talaina o pisinisi, le nai tū la o le whae le afiafi. O tangata whai ngā luenga mana o mia, o le malo ma pisinisi. Ia lei lava le whafso taipea o pule o tau ngā luenga, pisinisi ma ngā luenga le malo mana o mia. Ia pe te tauana o tau iai i whalwhai ngā luenga. A o tangata whai ngā luenga o le malo, o lo mwhai o na whai ngā luenga remotely, pe mai le whale, whao ngā ele computer, interneti, telefoni, ma tuainga communications whapena, ia e te tau lava o na soaswani pēr i ngā luenga remotely al malo pe a whai o oe, e mana o mia lau soaswani. Tau o tele lava le pe ona sau noa le whionga le whaatonu, so i fua malo loina. Whao ngā o tātou talifonga, face mask, ia pe a tātou wō i whale olo o uru whale ai tangata lau tele. Whale o malo, whale o pisinisi, ia so se mauta po se whale i tonu Amerika Samoa, ia olo o mwhai o na uru whale ai tangata lau tele, ia olo o whaatulanga ina le whaunga ina o talifonga. Ia o fo i tonu ta vale lau pasese, ia po tātou pasi, taxis, ia whapena e tau lava o na whaunga ia tātou talifonga. O le tūlanga i tātou whale ainga, whale tau mawha sei tūlou, ia o tāpunia le tau mawha i tonu o whale ainga. Ia aina o take out e tau o na whaunga ina. I ainga lava o lo o iai tonu o tātou atunu. O na o mia i o le self-quarantine. O lona winga o le filifili lava o tātou ma o tātou ainga. E awane i o tangata i whafo pe so ona whewai. Wanga nā lava se mea matuata tau. Matuata ua lava le self-quarantine o le code red. Ia e te tau lava o na usta ia le nā tūlanga. Tau whai e nofo le tono whale e malu pui pui ai. Ia mawhai ia inga ia o sau noa tuai le tātou tanga luenga so i fua malolo ina. Whao ngā tali fonga, social distance, ia awane i titi i fua le ono futu le vā Malaysi, ia ma whano se i tūlou pe wha maia au i sanitizers. Ia, o loo iai tau sanga tātou atunu i tūlanga i o pototonga ona o maliu. Ia ele mwhai o na tau fia le tūlanga, a iei se fina ngalo o le whionga le Govan Lutena. Tifo i le ono futu, le vāo lea tangata ma lea tangata. Ia olo iei fo i se policy e whaapea i le aso le whalawasi ai le tangata maliu o le ainga. Ia e alusao atua le ta avale po le sao o watu ai le pusa maliu. Ia mai le whanmai, ia po le morgue, i le tunga mau al nā tangata. Ia mawhaatino ai loa ia se lotu. Ia awane i sili atu le sfulu ia tangata iai le nā sauninga i le tunga mau. Ia o se whinangalo nā o loo consider le nei teimi. Ia ina ia mawhai ona pui pui ia le saunga le mu o tātou tangata. Ia ai whamali e ina fo ia whinangalo ainga. Ina ia whatau nu ina pēr le te wina mal whalawasi o lātou tangata pele o ainga. O le taupu le price gouging, pisinisi. Ia toi whamanatu atu ia tātou pisinisi. O le teimi nei o le whalawlawe whafuasei. Matua whasa ina na so na si ia tau o tau o loa. Matua whasa ina lava. Ma o nei ia inga uma lava o loo whamalusia e malu o le malo po ali matamaita i leo leo. Ia whapea fo i whionga i whaipule po o puli nuu. Ia i lea whio anga ma lea whio anga. Ina ia malu pui pui ai lo tātou atunuu. O nei tūlāwhona uma ma ia inga. Ia ona o le tau whai lava ina ia pui puia le mamalu le atunuu mai le nei wha mai. Ia o tō tonga nā ma se whapulanga ia awa ia le tūlanga o le Code Red.
Sili, ia ono le whamalamalanga fo i o tūlanga o le tātou Code Red, mo le silafia le tātou atunuu. Temi nei o le atu atulo le avanoa i le malu o le au Whai Newspaper, mai nā tō Whai News, ia mo ni o tō Fasili, ia wāwhai tūlanga o le tātou whamoemoe. This is a time for our media to ask questions of our presenters today.
Tosi, did you want to go first? Okay. Thank you, Lieutenant Governor. So I heard you mention that flights from Samoa are going to start repatriating them as early as Wednesday. If somebody's watching in Samoa now and wants to get the ball rolling on that, what action do you recommend that they take?
We have all the names of the people who are stuck, and so we're going to take care of those people. So we know who they are and where they are. And so we are already in contact with them.
Okay, great. And as far as the Code Red, Mr. Attorney General, that I heard you mentioning, did DPS make any arrests lately of people that were violating the Code Red, or?
DPS is enforcing. We haven't received the number of arrests that they have made, but any violation is a misdemeanor A, which is punishable by up to a $1,000 fine and a jail term of 1 year.
And as far as the curfew, so you have 9 o'clock, you should be off the road by 9, everybody, right?
Yes, except
What-
for essential
Okay.
service vehicles and those who are enforcing the curfew, the pulenu'u, police officers.
And then what time the following day can they get back on the road and start going about their?
4:30 a.m.
4:30
because
a.m.
businesses are allowed to open from 5 a.m. Onwards
I see.
till 4 p.m.
Okay. And I had a question too for the members from the hospital team, Dr. Seliapanga and Chief Falmina. Do you guys have any protocols for people who are sick? Are they still able to go to the hospital? I mean, we hear that essential services are kind of on a different level than we're used to. Like, say somebody's sick with something that's not coronavirus, just sick. What do you recommend they do?
I remember we had an emergency meeting on holiday, because of the positive cases on the island. Then right after that, we had a meeting on Tuesday. It's all leaders, CEO, everybody. And we sat down. Right now, we have a protocol. Anybody, regardless, who wants to go into the AR or any clinic for some reason, even though the clinics are closed down, for shots for medical disease, they have to be tested first, COVID test. And though, they are warned, they have to wait there, delay a little bit because of the test results. It may take 20 or 25 minutes. Once the test comes back, then we separate the positive and the negative. The other thing we're doing right now, we're separating the vaccinated from unvaccinated, in case these guys, especially unvaccinated, are test positive. So we have a really good protocol. Ever since we started that, we have about 8 cases from the hospital. 8 or 9 cases. We had 2 yesterday. So as far as hospital now, the reason why we did this is to make sure that the health care, the givers, are not affected. If we didn't do that, imagine, we didn't have any protocol for them. By this time, probably 50% or 60% of the staff, nurses, doctors, janitors, everybody. So as far as hospital right now, we're doing pretty good. We're doing very, we try to safeguard everybody, make sure the virus doesn't get there. That's why, let's go back to what I feel is said. The most important solution to this problem, vaccination. That's why I urge, yesterday we talked about the percentage. 6.8 of the whole population, they're not vaccinated. That's about 3,000 people. That's a dangerous population. That's why I'm urging everybody. Because even though we're doing the best we can, if they don't help us, the virus is going to be here forever. You might be gone and still there. Because what happens, they infect these people, then we isolate them. Next time we test them, it's negative. And then they go on their own, whatever, then they come back, they're positive again. So it's a solution to this problem. Now we have the virus everywhere now. Vaccination. We go like 90, as the LT was saying, or even 100%. Let's do something about this unvaccinated. Those are the bad people. To me, they are bad people. They're bad apples in the salad. That's why I urge everybody, ka kua ngā mā kou, banga wale le o ioi, I alofa kou, ko wainga, o wō, o lau au loku, mali ko malo, ko sosong main ma ko mele fai. Ol me piko siri ngang kaua, wha mai ngai, ol whai alo tui pui pui. Pui pui ioi mau tātai umai tāno. Ngā ole ngale toi ole tātou li mele nei, go red, go blue, or go yellow. Ngā yeile sa alkong ka ko ka whio iai mo ka whao. But as long as this population, the 3,000 people, they need to come and be vaccinated. Does that answer your question?
Yes, thank you for being very thorough in that, Malalaba. Lieutenant Governor, one other question that some people had was just about the ASG operations is OMV and immigration, like say their stickers run out in February, we're on the last day of February, or vice versa with an immigration ID. What do you have to tell people that might be concerned, oh geez, I don't want my expiration to expire or my ID to run out?
Thank you for the question, John. At this time, we would like to ask the public to be patient with regards to those issues. We will work with the Attorney General and the Commissioner of Public Safety to make sure that any of those expired license plates and cards that happened during the time of Code Red are accepted and does not result in any penalty to the person. But we will reconsider the issue after we get out of the Code Red status that we're in, and maybe open some limited services so that folks who are experiencing these expired cards and IDs can come in and get those renewed.
I see. And you mentioned the Code Red. How long do you see that in the foreseeable future? I mean, I'm looking at it right now, and so far we've got no hospitalizations. And if I'm sure you too followed like Hawaii when they got it, right? When we hit like 30 cases, that's when you start seeing people getting admitted to the hospital and whatnot. So, I mean, from a layman's point of view, that's pretty encouraging. What needs to happen in order to move out of Code Red?
Thank you for the question. As I have said before, all of our directions will be done based on evidence on the ground, advice from our medical community on where we move. So it would be premature of me to give an answer. But as I also said before, this is the stage where we learn to live with COVID, which is, based on all assessments, this will be around for a while. So we will take a look at it. We will make adjustments. Ideally, we will get to a point where we are all comfortable with masking and social distancing, and then we can slowly open up more services. As you know, at this point, most of our businesses are still operational, so we are not in a strict Code Red shutdown as has experienced before, and we've done that in view of all of the information that we receive. So short answer is the duration of Code Red will be based on evidence on the ground and advice from the medical community.
And Motusa, if I could ask you or your team here, we were looking at the numbers and you had like 1,200 people show up on Saturday. which is great. But it looked like 90+% of them were already vaccinated. They were getting their booster. And just a fraction of that was like first-time shots. Have you considered doing something like APIA did, where they just go out, and you've done this before, like with the lymphatic filariasis, where you canvass each village with vaccines to get that unvaccinated population? Have you thought about walking the village and giving people their shots that way versus like you going to them versus them coming to you like on Saturday or what you've got going on now?
Thank you for the question, John. Right now, we're looking at what's going on, assess what's going on the ground. We've already did our first Saturday, drive-through. So there's also organizations and groups that are requesting such service. But because of our limited staff, we have to look at the general population and make sure we maintain those sites that are dedicated for that service. Also, we understand that there's a very high number of our population that do need the booster shot, and they are coming in. So we just got to prepare to make sure we have enough vaccines on hand. Going out to the community, family to family, we will have a challenge on that because we have to maintain the temperature of our vaccine. So that's why we have to get closer to the community, but and also at the same time maintain the temperature of the vaccine to be able to give out. And that's our position right now. And we are open to any recommendation that will make the people come in to get their vaccination. Thank you.
I see. Okay. Thank you. I didn't have anything else. Thank you all very much for inviting us.
More questions, feel free to ask or send me an email.
Yes, thank you, Gar, and also the committee. We're hitting 600 comments on our live feed already, but we just have a couple of questions that we would like to ask Famun Mule. We're seeing, perhaps this is good news, that we're seeing a sort of a drop in the numbers of those tested positive from the 18 we had last week to 2 now, and which I hope, touch wood, that this is a sign that the virus is slowly dying, hopefully. My question, though, is that with the 14 days clause, it's been given to those to the people who are tested positive, and then they self-isolate at home. Do you think that this is impacting on the efforts by DOH to get them to come and get tested, because of the fear that if you get tested, that you could be self-isolated at home for 14 days? And also, we would like to know of what happened to the family, the family that first got tested, how are they doing, and how is DOH is monitoring the self-isolation thing at home.
Or spread the infection to other population. We do have our children to consider who cannot get the vaccines, and we also have people who are immunocompromised that medically they cannot get the vaccine, and we also know that half of our population have comorbidities. So someone who's responsible would want to know what's wrong with them, take care of themselves better, or isolate themselves so that they don't spread the infection to our loved ones, our families, and our friends out there. Thank you.
Thank you, Tosi, for the question. I just want to add on to answer the question whether it's hindering our efforts to get people in. That is one of our concerns, and the government here, we are looking at everything that we're doing to make sure that, one, we are abiding by the code red status, and at the same time to protect people, and at the same time allowing for those who need to come get tested to get tested. If we look at the number of cases that we are getting every day, like I showed earlier, seems like there was a surge on the 24th, and the number of cases started to drop. That's what I'm afraid of. That drop in number of cases is probably not accurately reflecting what's happening out in the public. So we still, these are one of the things that the government is allowing for this time period before the curfew happens. If you are symptomatic, have been exposed, to please come out to one of our testing centers. It doesn't mean that people are going to go and roam around. Just come out to the testing center, get yourself tested, and get yourself protected. Like I also mentioned before, 10 individuals were treated. We've identified and have treated for the COVID-19 virus. These could have been 10 hospitalizations. These could have been 10 deaths. But because of the process that we're doing, calling every day and finding out how they're doing, looking at their symptom status, and then sending out either the EMS or the DHSS dial-a-rod program to pick up these individuals to come in and get themselves treated. So those are the things that we're doing right now to ensure or to minimize hospitalization and even severe death, severe disease. I hope that answers the question.
Thank you. Yes.
Yeah. Tengo fa Samoa nangai e kaua ia le sili la le KVZK. Pio sili va pea. Fa fenga kai a wala wa vai ngei le meleo ye o e pe fa pe mai lau tashua po positive wa vai atu a sulfaso tu SSR e vel metau mafa. E la tata fa pena o te tatonu ele pasene ole ole tunu o botitula tul mela ele fia oia si lela pa ola lue fai se kui le fai le test la tunu o e ta ua ia tangata ia ta no i tatou ta ia ta uno mai wale lo tatou pe possible ta uno mai fai la to tui ma fai ya vaccinate tu puia e lo tatou o leo fe ngai ne tatou mal fama e le si le na e fai la mea ai tatou na ma to sul mal faso e le se mea umi a fai lo sul mal faso na o fai se ngore ngai i lo ainga o lo e kalesia o nu matata o mai to fewa mele tatou na ma to fa malo si mai o sul mal faso e sil to tala vola tatou feso. Prevention is better than cure. E sil ya tu le tonga fitio oe. Il temine ele mo, il teme mo ai oe. Non te lele la fai, fa mo mole le tu. Non fa rafti fa sa mo tu la ta o sil ile al. Ti viv, of te lava.
O le sia ofisiri fa mole a pole a se tu langa bo e si a inga lenga test mo mua po le lei po sorry, o le si fisili na le tu mai dungo le tatou feed fa mole.
Fa tai leva mo le fisili. E lo fa ia pelinga wenga mtanga wenga. E ile lisi o ila toia sa positive ia lato suenga. E lo fa ia le ngal wenga le o le vala au aso uma every day. E lo get fongi vala au po how are they doing? Ia te mine wa to nele le ono aso talu ona tula I mai positive tia la suenga ya lo malo si pea lo nga soina le ya ele inicio symptomatic nga tasile ali o le ainga le sa symptomatic ya o le li fo ile sa watu waile le fo ile le tautua le o le EMS e mai la to tonu faia la to therapeutic treatment ya le sa faile therapeutic treatment la sto nai ya ma manuia fo ia
Alo faftai le ofisilia na len tu mai dungol tatu ai sitina le fie lo fa mo le Dr. Tufa pe o ini si o malo lo si mai treatment si na fai pe fie se numero
e to se fulu I la to sa fai la to treatment ya ina ua mai al fai ngo treatment ya o moment tala o malo si la to sa watu tonu o fa ali mai ya unga o le fa mai ya ina ua uma ona fai le treatment ya o fa longo atu o to e mawar malosi ya o fa maunga fo ya I o tangata I lo I fa fo I Amerika ya fa pe fo I sia tu no Pasifika le sa atu ai le treatment ya fa mai e watu tonu o fa le fa longo tino a ina o uma ona fa le treatment ya o sui le fa longo na pe o malosi ya o le sile awala em fa e tatou ona fa I ti 11 noa e mau ai le maitinga inga mai le COVID-19, e tau lava o nau mai tonu, a whai o lo o inga aunga o wha mai, pe tale, pe fiva, pe whaingatā o na mānawa. Ia, o le teimi tonu an nei e tau no atu i le testing site le Department of Health, le i Leone, ia o le isi le i Tāfuna le Community Health Center, ia whapea fo le Community Health Center i Amauli. E whai o tō suenga, ia a whai wa test positive, ia o i nā fo i la a whai ele assessment a fo mai, ma wa ai pēanga waa mo le whainga o le therapeutic treatment. E tō sfuru la i la tō wa uma o na whai le therapeutic treatment, ma tō sfuru fo i lea, le ua mawhai a o na take care i whafo community, ma ele mana o mia no o tonu o tato whan mai tu mau i LPJ.
O le asau whautuanga toi tasia, sorry Gar, mo le mamano le atunu wan mele na mai tau le aso tō nai. E ia se le i furu mana ala o atu e whai le test. E ono pipisi e fo i le wha mai. Ai pe po le asa whautuanga le matanga luenga fo le pese i vanga na ai la tō e whalonga atu a matuna tale matulanga fa penai o atu e whai le test.
Ele i mau atu alo fisiri?
Se whautuanga le matanga luenga mo le atunu, ai mei se la tō, ia mei se tātou drive-through ma fufuanga nai whai. Whaina na nau tangata e whalonga atu nai a fia, e o atu whai test. Au la tō e le o kale pe furu pe na ua fole o atu i me whai le testi a fia tō i masisi il whamai.
Ia whawhitai lava e sao. A whai ua hali ai mai ia unga whamai, pe tale, pe fiva, whaingatā o na mānawa, ia pe tawhe fwoi le isu se tulou, ia o te temi tonu anei e tauna atu ai tonu e whai e suenga, ia mawawa ai fō mai, pe mana o mia o na whai le waila au le therapeutic treatment mo le monoclonal antibody, ia whapea fwoi le antiviral. Ai a whai e le ingi aunga, e le i whelata i fo i se isi sa test positive, po se isi sa malanga mai se teimi lata mai nei. Ia, e wha mole mole, e le eise mafua anga laina sau fu e test, o le vairusa lea, e ta tau ona e whelata i tangata lea sa test positive, e le wha pēla a whai e tutusa le nuu, you're not exposed. Se i lona lava ua umi se teimi, pe 5 minute pe sili atu foi, na e whelata i tangata lea sa test positive, po se tangata foi, lea lo o alia i mai aunga. A whaila ele e ingi ni tūlanga ngā sa tūla i mai, ia wha mole mole. Whai tia i le tato traffic lunga le awala, i tato munmuta i le code red, au tam whai e whai tia le pesi e wha mai, na o la tau lava, lea lo o alia i mai ia symptoms po o aunga wha mai, ia whapea fo inisi na mauti noa na whelata i tangata lea sa test positive. Pe ua tali fisili.
Thanks, Doc. Wa uma fo ima.
So, pangana ai pe ai se o le media le fisilingia sa lato fisili, o le atato tua tulo le vano le fionga le maupu e wha uma tato aso.
Thank you very much. I think Dr. Ivy had given a complete study report on the situation of our COVID cases on Ireland. At this point in time, LBJ is executing its full COVID emergency plan since the declaration of Code Red by Governor Lemanu, which requires everyone that comes to LBJ must go through testing and question about the status of their vaccinations. And this is a joint effort by LBJ to help the Department of Health with our preventative measures. Well, ole moriaklanga nga whamaloma whafkail kakoa ngu, o paia fo ima kulanga samwhai ngā o man kureisa ngole fionga luken kovanga, e kusai markako whaksingan ngei asu. Ai moriaklanga nga whafkaikele maror kakoa ngu ilo kokula imai. E leo skulanga whaingo fie le masangi el kakoa ngu ngei kulanga o soifuanga u kako iai. Ai panga lea, whainga leo soifuanga e kofo kako, leo o mai wha mai, e kaufong kako kumalosi. Ko e whakulanga o kako soifuanga, o kako iai. Leo kou whaafonga kankangi ako le whionga fo mai sili a sa le panga. O le kui. Le nganga e kau mwhai e pui. Kulanga i o kako mai ia o penga li poki ako le sunga ia ai while ongos fulima. O la kou a umanga. Su e positive. Asymptomatic. Longa winga ele ongo ka fia. Mea ngā o le kala le ngā te inga sa ngā aku le ko vanga lukenga o le kala fia ele eska ko mai o ka fia. O lo winga o kulanga, kalu ai la ngā o kui, le ngā i o kako kui pe inga sa ngā aku sa le apanga. Wa e ka fia klon ngasi, ia o ia malanga vaenga o la afea ngaile, kausingo o ngasi pe ka fia. Pe o le ngā kankangia ko le sunga o fomasili, le aku ue e kako o sai whakasi. Kulai mai e kako kuwa kasi. E whai o kako kui ma sosoangi a mok sa malanga vaenga a wal pui ngol o le aku umari e wha maa. Kalo ia i le kua. A lofa sosoangi mai. Kat kongu foi. E le kula fo ia kako. Leo o le ein kako saunginga. Kalo e le maka o le kako akungu. Inga ia kako pui ar kako akungu. Ia sa mako whaso aku ngā ma le mako sosoangi aku le ia ma le malu o le akungu. Meise lau whai ngā malo. Ai ngangel pa ia o lau whainga luenga le kua. I la o kou whai kalo ma la o kou whai kaulanga i le aso ma le aso. Ia manguia per ka kua kou. Ia ua lama ngai o se whaia ka kou pe maa whakia ngai wha mai. Ia sa mako whafkai aku ngā ai a ka kou kumalosi. Wha waur ka kou ngā luenga o le pui. Ia ma kausir ka kou waku ngofo. Inga ia baua pele soifua manguia o ka kua kou. Whafkai aku lau a whionga. Ko wanga lukenga o mole. Ka kou aso.
Tai, ia o i una o le tātou whamoemoe Amerika Samoa, le ua tu leila whionga il maupu e anga tonu ai o tō pa ia ma mamalu, o le wholo whawailolo le tō whal tō o ia tau ese, ia ma pa ia ese o le nei ia whaatasinga, o le anganga fia ma le anganga whawhitai, il mamalu o le tātou atunua no lo tō lava papale pea ma le ona sa'i nei vai tau o tingā puipuinga o lo tātou soifuanga. Mo le atfoi le ngā whawhitai le mamalu o li i matamai tai fo mai o lo o whiangai ma le tausinga o le soifua malolo ina o sio tātou atunuu. Whapena fo e ia le taitai o le tātou ofisa o le soifua malolo ina e whapea le tātou whale mai. Malo lava le ngā lulue, malo le ona sa'i. A wale tonga fitinga o le nei whamai. Whapena fwoi le nganga fia ma le nganga whawhitai e moli atu i a tātou malu le malo. Ia whapea fwoi le ofisa o le Samoan Affairs ma pule nuu. Ia ma pule anga nuu taitasi. Whamalo whawhitai. I lo o tō talia mai o se wala awa le fionga le kovana. Ia wā fwoi lo tātou nofo mawai puipuinga o le Code Red i nei vai tau. Ia tātou ona sa'i pea, whaali mai le tua, ia le awala e mwhaiona tātou nofo pui ai. O nei whaalinga o le wala au nei mo tātou first responders uma, iau fia aia tātou leo mai pule nuu mai lātou ia o lo fuafua e ngā lulue i tātou ngaluenga ia whafsotai mai ma o mai e whai tātou booster, i lātou e le whai al booster, mana o mia lava ina ia lava puipuia tātou, ina ia aua nei PC al whamai, ia i tātou ia o lo whia ngai malenga luenga. O le, that is the end of our press conference today. I want to thank everybody for coming, our media friends. Thank you for your part in informing our community about what's happening. And I know that some of you want to get immediate answers to your questions right away, but the task force has instituted this policy to protect our doctors and our frontline workers, so that all your queries and questions about this and different aspects of this operation, please direct it to the EOC. And we will make sure that your answers are provided either through email or through these types of press conferences. And we will only have a few of these, maybe twice a week or once a week, so that we can spend the rest of our time doing the work that's necessary to protect our people. But do apologize if there's any delay in our responding to your questions. We will try to do a better job of giving you the information. Daily press releases will be submitted to the public and members of the media after 6 p.m. Depending on how busy the day is, that release may be a little later, but our goal is to try to have something to you after 6 o'clock. If something very important has happened during the day, we will have a press conference the following day. Otherwise, we will continue to communicate via email, so send us email, we'll respond as best as we can. So thank you, American Samoa, for being with us today. We hope this press conference provided additional information so that you can learn to help us protect our island from further spread of COVID-19. So fua mai manuia le nei aso i le alofo le tua, whaftai.